Hi, back to part 2 of chapter 7. Let me go ahead and share my screen. Okay, all right. So we're going to start this part by talking about case-based assessment using cases, case scenarios, clinical scenarios for assessment. So you develop a brief clinical scenario. You present enough information, again, enough for analysis without excessive information. Um, and you usually typically focus on something specific. Um, they're versatile. You can use them in class, you can use them on exams. Very, very helpful, and really a good framework for higher level learning. It encourages them to think beyond just knowledge recall. And these situations can be combined with questions that require the students to apply concepts or analyze situations or evaluate options based on the case scenario. All right. Make sure you use higher level questions in your case study, in your case scenario. You're setting up this case scenario to make them critically think. Make sure you use critically thinking type of questions. Maybe a flexible item format. You could have them even do a group discussion afterwards, um, either during or after, whatever it is you're trying to accomplish. But afterwards is great because then they can get together in a small group and discuss what they chose, why they chose it, how they came across it. So an example, a patient is admitted with a headache, nausea, and vomiting. 2 hours after admission, she complains that her headache is worsening and she's having trouble seeing. Analyze the case in terms of content presented today in class. What data are most important and why? And how does this compare with chapter 7 in your book? And this case presents a neurological situation requiring immediate assessment and intervention. The changing symptoms create a time-sensitive scenario that tests the student's ability to recognize potentially serious developments. And it requires students to analyze the case using presented content that you just gave them, identify and prioritize critical assessment data, compare it to the textbook, and this uses multi-level analysis, assessing students' ability to integrate classroom learning and clinical reasoning in an urgent case scenario. Pediatric example, you are discharging a 7-year-old child who's been admitted following an asthma attack. In talking with the mother, you learn the child has been seen in the ER at your hospital and elsewhere nearly monthly for the last year. So, I mean, that's a basic, simple scenario, not a lot of detail. Question 1, what are 2 different actions you could take at this time? Question 2, which of these would you actually do and why? So this pediatric case focuses on discharge planning with case management. The frequent emergency room department visits suggest that the asthma is not controlled. It they don't have good management. So where are you going to go with that from your discharge planning? The assessment questions require the students to identify multiple possible interventions, which makes divergent thinking, and then select and justify the most appropriate, demonstrating clinical decision-making and evaluation learning, and helps them to recognize patterns, suggesting poor disease management, and develop appropriate responses for how they could help this family do better. Okay, another example, ethical dilemma. So, um, this is your first clinical experience in a long-term care facility. You observe a concerning practice. The nursing assistant ties patients to chairs before dinner. What would you do and why? They have to identify the ethical principles involved, choose the appropriate action, and explain their justification for that. So it assesses ethical reasoning, professional responsibility, advocacy skills, resident rights, proper restraint policies, the student's role as a learner in a clinical environment. You could ask them even in two different ways. As a student, what would you do and why and how? And as a new nurse, what would you do? How? Why? So those three examples just kind of show different levels, like um, pediatric discharge and future planning, ethical, um, oops, sorry, ethical. The first one was looking more at like a pathophysiological problem with the neurology. So just different examples that you can use this for. One more, I believe, case example in clinical decision making. A 12-year-old comes in to the pediatrician for an allergy injection, and the mother says that her child had a fever yesterday, but it's fine now. And the RN gives the injection. So, was this the correct decision? Why or why not? What potential complications could arise? What protocols should govern this situation? And this question requires students to critically think and provide rationales based on evidence and best practice. They'll have to apply their knowledge of medication safety, pediatric assessment, professional accountability in a specific context. It will look at their understanding on appropriate assessment prior to administering injections and contraindications. So that's just another really simple, short example. Okay. Case study assessment. This is a little more comprehensive, more detailed than short cases. It might include multiple aspects of care. More comprehensive analysis is usually needed. It's more complex and integrates multiple knowledge domains. The emphasis on rationale and having the students explaining what it is, why they chose it, why they're doing what they're doing. A distinctive feature of a case study assessment emphasizes the student on rationale. Not just the underlying analysis and decisions, but the rationale for it. Helps give insight into students' thinking patterns and depth of understanding rather than just their conclusions. You can use unfolding case studies. You have the initial presentation, early assessment, maybe some preliminary interventions, and then sequential presentation, what happens next, what are they going to do, and the outcome phase, which should kind of mirror actual clinical practice. The unfolding case studies stimulate patients over time and help the students continue their assessment, look at the outcomes of their interventions, and base new assessment and interventions from the old ones. It helps them to adjust and plan accordingly and is more realistic to actual clinical settings. Use an introduction, a brief paragraph, like with background information. You might follow that with some assessment questions. You can do these in small group discussions even. Then subsequent paragraphs that change the scenario with new data, time progression or status changes, and then progressive questions to follow the new data. Okay, an example. Unfolding case study example, home visit. So you're making a home visit to see a 71-year-old man, I guess, 71-year-old man with a leg ulcer that began after he fell. The patient is coughing and wheezing and tells you that he feels terrible. What assessment data, that's your scenario, assessment 1, what assessment data would you collect on the initial assessment and why? Question 2, what actions would you take during this home visit and provide a rationale? So this case study begins in a home health setting, presenting a patient with multiple concerns, a leg ulcer, respiratory symptoms. Are the students able to prioritize their assessment when they have 2 or more problems at the same time? It requires them to identify additional information, take appropriate nursing actions, evaluate their clinical decision making, and make sure they give rationales for their decisions. Second one, 3 days later, you visit this patient again. He has increased shortness of breath, more fatigue, and is pale. So the scenario development indicates deterioration of the patient's condition, shifting the assessment priorities and creating urgency in the clinical decision-making process. So question 1, does this new information change your impression of his problems? Why or why not? And question 2, list priority problems for this patient with a brief rationale. And these questions help evaluate the student's ability to recognize significant changes in patient status and reprioritize their nursing care appropriately. Final visit of this study, the patient recovers from that episode, and you're able to go visit him one more time. It's a her now. Sorry, the pictures didn't quite match, so it is what it is. At this time, she's still short of breath, but otherwise seems improved. And they're asked to write a final report on this patient for the home care agency. And this last task assesses the student's ability to document and to synthesize information with using multiple events that had occurred. So you're looking at appropriate documentation. They'd have to think about agency standards. Maybe you can give them some standards, like pretend agency standards to use. Can they concisely communicate the study, the patient, and what happened and what was done? So even something like documentation and synthesis in an unfolding case study. Okay, and we are going to take a break here and come back in part 3.